Welcome to our video on the often overlooked dangers to our health. In today's fast-paced world, we might miss subtle signs our bodies give us, and external factors can also pose significant risks. Understanding these threats and how to avoid them is crucial for maintaining our well-being. Let's dive into some common yet serious health risks and preventive measures. 1. Air pollution. Air pollution is a major health hazard, often caused by vehicle emissions, industrial discharge, and particulate matter. Exposure to polluted air can lead to respiratory diseases, cardiovascular problems, and even lung cancer. Prevention. Minimize outdoor activities during high pollution periods, particularly if you have pre-existing health conditions. Use air purifiers indoors to help filter out pollutants. Support policies and practices that aim to reduce emissions and improve air quality. 2. Exposure to harmful chemicals. Harmful chemicals are present in pesticides, industrial solvents, and various household products. Chronic exposure can result in poisoning, cancer, and neurological damage. Prevention. Wear protective gear like gloves and masks when handling chemicals. Follow safety guidelines for the use and storage of chemicals. Ensure proper ventilation in areas where chemicals are used or stored. 3. Unsafe food. Eating contaminated or improperly stored food can lead to food poisoning, gastrointestinal infections, and other serious health issues. Prevention. Practice good food hygiene. Wash your hands, cook food thoroughly, and avoid cross-contamination. Store food properly, refrigerate perishables, and maintain the right temperature. Be cautious with food sources. Buy from reputable vendors and check for recall. 4. Substance abuse. Substance abuse, including overuse of prescription medications, recreational drugs, or alcohol, can lead to addiction, liver damage, and other health complications. Prevention. Follow prescribed dosages and consult your doctor before altering medication use. Seek help for addiction. Support groups and professional counseling can provide assistance. Avoid illegal substances and consume alcohol responsibly. 5. UV radiation. Excessive exposure to ultraviolet UV radiation from the sun can cause skin cancer, premature aging, and eye damage. Prevention. Use sunscreen with high SPF to protect your skin. Wear protective clothing like hats and sunglasses. Avoid prolonged sun exposure, especially during peak hours. 6. Unsafe living environments. Living near industrial sites or areas with poor environmental conditions can pose long-term health risks. Prevention. Research the area before moving. Check for nearby sources of pollution or hazards. Improve indoor air quality with proper ventilation and air filters. Advocate for environmental regulations that protect public health. 7. Infectious diseases. Not vaccinating or taking precautions against infectious diseases can lead to serious illnesses and complications. Prevention. Get vaccinated according to recommended schedules. Practice good hygiene. Wash hands regularly and avoid close contact with sick individuals. Stay informed about outbreaks and follow public health advice. 8. Electrical hazards. Using faulty electrical equipment or improper handling of electrical devices can lead to electric shocks or fires. Prevention. Regularly inspect electrical equipment for signs of damage or wear. Use devices according to instructions and avoid overloading circuits. Install smoke detectors and keep them in working order. 9. Traffic accidents. Negligence in traffic, such as not wearing seat belts, driving under the influence, or distracted driving, can cause severe accidents. Prevention. Always wear seat belts and ensure all passengers do the same. Avoid driving under the influence of alcohol or drugs. Stay focused on the road. Minimize distractions and obey traffic laws. 10. Animal bites and infections. Exposure to wild animals or pets with unknown health status can result in diseases like rabies or parasitic infections. Prevention. Ensure pets are regularly checked by a veterinarian and vaccinated. Avoid contact with wild animals and seek medical advice if bitten. Practice good hygiene when handling animals and their waste. 11. Noise pollution. Long-term exposure to high noise levels, such as from industrial machinery or traffic, can lead to hearing loss, stress, and reduced quality of life. Prevention. Use ear protection, such as earplugs or earmuffs, in noisy environments. Minimize exposure to loud noises and maintain a safe distance from noise sources. Regularly check hearing and address any issues early. 12. Heavy metal poisoning. Exposure to heavy metals like lead, mercury, and cadmium, often from industrial sources or environmental contamination, can cause severe health issues. Prevention. Monitor heavy metal levels in your environment and in your body if at risk. Use protective gear and follow safety protocols in environments where heavy metals are present. Undergo regular health screenings to detect and address heavy metal exposure early. 13. Sudden temperature changes. Rapid shifts in temperature, such as moving from a hot environment to a cold one, can cause health issues like colds, heat stroke, or pneumonia. Prevention. Adjust gradually to temperature changes. Maintain proper clothing and warmth when needed. Avoid sudden temperature changes and ensure a stable living environment. 14. Unsafe personal care products. Using personal care products with harmful chemicals, such as certain cosmetics or skincare products, can cause skin irritation, allergies, or other health issues. Prevention. Choose products from reputable brands and check ingredient lists. Patch test new products before full use. Monitor your body's reaction and discontinue use if any adverse effects occur. 15. Sports injuries. Engaging in sports without proper technique or protective gear can result in injuries, fractures, or other health issues. Prevention. Use appropriate protective equipment for your sport. Warm up and stretch before and after exercise. Learn and practice proper techniques to reduce injury risk. 16. Excessive social media use. Overuse of social media can lead to mental health issues such as anxiety, depression, and feelings of isolation. Prevention. Set limits on social media use and balance it with real-life interactions. Engage in real-world social activities to maintain healthy relationships. Seek support if you experience negative effects from social media use. 17. Hazardous consumer products. Using consumer products with hazardous chemicals, such as cleaning agents, can lead to skin irritation, respiratory issues, or other health problems. Prevention. Choose environmentally friendly products and avoid those with harmful chemicals. Read product labels and follow safety instructions. Use natural alternatives when possible to minimize chemical exposure. 18. Unsafe work environments. Unsafe work environments, such as inadequate lighting, poor ventilation, or stress factors, can significantly impact physical and mental health. Prevention. Ensure proper lighting and ventilation in your workspace. Reduce work-related stress by managing workload and taking breaks. Seek support from supervisors or health professionals if your work environment affects your health. Health is our most valuable asset, and it is essential to protect and cherish it. Potential dangers from our environment, unhealthy habits, and external risks can have a significant impact on our well-being. However, by paying attention to warning signs and applying effective preventive measures, many issues can be controlled and avoided. By taking proactive steps in our daily lives, we can build a healthier lifestyle, not only for ourselves, but also for the well-being of our communities. Small